And I think that's sort of why I find sexological bodywork so compelling. The potential of sexological bodywork to be embracing all of that, not stepping outside of any of the bounds or any of the tools that we're trained to use actually, but that listening, mirroring, labeling, and mapping are sufficient tools with which to track trauma through the nervous system as your hands are dealing with the physical artifact of the physical scar in the pelvic floor or in the abdominal region or even in head, neck, chest, wherever you might choose to touch the body. There are injuries, and those injuries can be felt and processed through with the techniques we learn in sexological bodywork.
Right, and I think that strengthening those capacities of not just simply holding space, but actually knowing how to track nervous systems through visually and to doing that through your own body and, resolving and negotiating your own nervous system oscillations and patterning, and then being able to feel that through actual touch and palpation and feeling those shifts through all of the dorsal stages, the ventral, dorsal, to like following
ventral, dorsal, vagus nerve stages. Is that what you're talking about here?
Yes.
Just unpack it a little bit.
Right.
Yes.
So, we can talk about polyvagal theory, and we can also feel it.
Yes.
We can feel that happening in our hands if we know what we're looking for.
Well, that means that you're actually inviting people in to be monitoring many things at one time. In other words, you're in your own body feeling your response to what's going on with the trauma. Meanwhile, you're tracking what's happening with the scar tissue. And you're watching for autonomic cueing from your client at the same time. That's a lot of material to be containing, but it's a skill. And like many skills, it requires practice.